Now, check now of the latest COVID-19 numbers, and 190 people have tested positive for the coronavirus disease in the last 24 hours out of a sample size of 4,609.
Well, this raises the cumulative number of positive cases to 35,793. Meanwhile, 385 people have recovered from the disease, but people have succumbed, bringing the total number of deaths to 616.
And as we continue our special coverage of 6 months a pandemic, we take a closer look at the COVID-19 death rate, both in the country and on the continent. The lower number of deaths recorded in Africa compared to Western countries has left several experts baffled.
Anita Nkonge looks at the contrast and possible reasons, despite initial assumptions that Africa would record some of the highest number of deaths globally.
Scientists around the world scramble to try to understand the COVID-19 virus. Something peculiar is emerging here in Kenya. It would seem that when compared to other Western countries, Kenya continues to record significantly lower death rates. So why is that?
A death to COVID-19 is one too many, but it appears things haven't turned out as bleak as they had been made out to be.
When I saw what China had to do to isolate such an enormous part of their population, my first thought was Africa. How in the world are they going to deal with this? It's going to be horrible in the developing world.
However, sub-Saharan African countries continue to record lower fatalities than predicted in comparison to the impact in the Western countries. For instance, as it stands, the United States of America has recorded over 196,000 deaths with 6.5 million positive COVID-19 patients. South Africa has recorded 15,265 deaths. Kenya has recorded 616 deaths from 35,793 confirmed cases.
If you look at the what we call the case fatality rate, it's about ours is 1.7%, meaning that every 100 or so confirmed COVID cases, just under 2 people will end up dying, at least in our circumstances.
This observation was confirmed in a recent study by the Kenya Medical Research Institute that looked into the lower than expected death rates. One of their theories is that a young population has played a part.
The much older population remains the biggest risk. The second risk is hypertension, diabetes, what we've seen as the cardiovascular diseases. Whereas we know they are rising in Africa, their level of prevalence, the numbers of people with hypertension and diabetes is much higher in Europe and America, which is related to obesity. You know, Africa has a very low obesity rate. South Africa has a much higher one, and therefore you've seen more death there.
But there may be other reasons that the country continues to record lower mortality.
The populace has largely been exposed to a lot of infections, infectious diseases. We have taken so many steps, probably with things to do with vaccination programs, and that has led to an immune system largely being alert to many of the infections around us.
Currently, there are 2 studies being done, one in Australia and one in Netherlands, looking at whether BCG could actually protect people from getting COVID-19. Was that it was noticed that in countries where they actually vaccinate children, all children with the BCG vaccine, these children, when they grow up, they maintain good immunity. Most countries in Africa actually vaccinate all children with BCG vaccine.
The Ministry of Health says intense research is being done on the matter to establish what may be the cause. As this is done, one wonders then what neighboring Tanzania seems to be doing differently that is working out for them. Anita Nkonge, NTV.